Noon and for our daily briefing. Me great pain. 3 more deaths in Illinois associated with COVID. One was a Will County resident in his 50s. Second, in her 80s. Third is a Florida resident who was in the county. My heart goes out to patients, and I speak for all of Illinois. We offer them our collective strength. May their memories be for a blessing. Or should they? We are fighting this fight for every person in Illinois. Today, in addition to Director Dr. Standing with me, Rob Carr, the President and CEO of the Illinois Retail Merchants Association, all ambassador of our Illinois aging. BASTA is here. This virus for older people, and it's my to ensure elderly Illinoisans as safe and secure as possible as we work together to respond to this and to flatten the curve. I ask her to speak to our about how they can take care of themselves during this distancing we can do to protect our seniors and to support everyone has to go out for. And while we encourage all our residents to help out their elderly, we also want to make sure that our seniors and to get the food and medicine they need. With the Retail Merchants Association, staff and I convened grocery stores from across the state to identify and address the fears our more vulnerable populations might have about getting the supplies that they need. I'm proud to announce that the store owners across the state have been more than willing to offer special hours for senior shoppers to come in and get their groceries without other shoppers present, so we can minimize risk. This dedicated period will also feature heightened social distancing. That Foods and Shop and Save here in Chicago, Hy-Vee throughout Illinois, among many, many others, and you should contact your local store to find out what the hours are that they have reserved. Rob Carr from the Illinois Association initiative and how we're as possible. We want our seniors to know that we're taking them safe and to do everything that we can to help them through this very challenging time. We're also working hard to ensure that all our residents are able to get as many of them, even homes. So today, we're significantly expanding and those who are providers to get reimbursed, allow patients more flexibility and safety in getting the medical guidance to doctors who may be listening. I want is operating with the latest and best practices regarding public health response. Emergency notification is called Siren. Upon yourself to sign up for our emergency d.siren.gov. Again, that's d.siren. Website for Siren, which is .gov. Every state should do this now. Our small businesses are already hurting. It isn't going to go away. I'm pleased to announce, however, today that my administration 20 bars and restaurants all across Illinois in sales and to local jurisdictions, and we're waiving late filing fees and interest starting tomorrow. Second, as of today, all businesses from every county in Illinois are now eligible to apply for low-interest virus disaster assistance loans of up to $2 million. I want to thank our federal officials, especially Senator Durbin and Senator Duckworth, for helping to push this through the Congress for us. For all Illinois small businesses, if you want to apply for these low-interest loans, you can find more information at disasterloan.sba.gov. Moving on to discuss our increasing number of COVID-19 cases in Illinois. As Dr. Ezekiel said, our total case count continues exponentially. Understand that our reports of case count will not abate soon. For now, this is because we're testing in Illinois. As of yesterday, we were 1,000 tests statewide, and in a few days we'll be increasing that to more than 2,000 tests per day. These tests are only discovering people who already have the virus. I know people in countries and even cities and jurisdictions around the United States seeing the numbers rise significantly every day. To take action, we're initiating a process that is intended to bend the curve. Earlier this week, I acted as the first members of the Illinois Guard missioned to join the fight against COVID-19. In total, the Guard is of really extraordinary citizens, but they would call themselves ordinary citizens, but they're 13,000 strong, committed to amazing work, and they bring to our preparations key capabilities in logistics, in transportation, and even medical specialties. In the short term, the Guard will be working to support our efforts to set up mobile testing units, allowing us to expand testing while ensuring that those tests can be administered in the safest possible way. The Guard is also doing critical work planning for the weeks and months ahead, including expanding our healthcare capacity by potentially refitting and reopening previously closed hospitals. We have to mitigate the spread of COVID-19. We have to slow the number of new cases and ensure our hospitals and our healthcare workers have the capacity and the resources to treat those who are sick. We have to flatten the curve. My team and I are working day and night, closely considering every option on the table to do this. We've seen measures adopted in other countries, as well as places in the United States, like San Francisco, and we're looking at every aspect of those steps to understand how best to keep Illinoisans safe. As always, we will share more with you as we know it, but I want to address some of the rumors that have been running around. Essential services will not close. Interstates, highways, and bridges will stay open. Grocery stores, pharmacies, gas stations, these sources of fundamental supplies will continue to operate. There is no need to run out and hoard food, gas, or medicine. Buy what you need within reason. There is enough to go around as long as people do not hoard. We will never shut these services down. And please, let's all remember that these essential institutions don't run on their own. The cashiers, the gas station attendants, the truckers, the pharmacists, the delivery workers, the sanitation workers, these are all people who keep our state on track. So please take every opportunity that you can to demonstrate your gratitude to them. Perhaps most importantly, there are some true heroes among us in this crisis. Our doctors, our registered nurses, our nurse practitioners, our hospital workers, our healthcare center operators, and our first responders. These are people who leave their families every day and expose themselves to the risks of COVID-19 by treating patients, more and more of whom are presenting with symptoms. Our healthcare workers and our first responders are the very best among us, and they deserve all the acts of kindness that we can muster. So your friend, the doctor, your neighbor, the nurse, see if they could use a helping hand. I promise you that it will mean more to them than you could ever know. Thank you, and now I'd like to turn it over today to our Director of the Illinois Department of Public Health, Dr. Ngozi Ezike.
Thank you, Governor, and again, I thank you for your amazing leadership. He is passionate about caring for the people of Illinois, and there's an outstanding team of people who are standing behind him. I am saddened to announce that 3 more individuals in Illinois have lost their life. These individuals, as was mentioned, were residents from Will County, Cook County, and a visitor in Sangamon County. Unfortunately, we do anticipate additional deaths. We continue to issue the guidance. Please, everyone, stay home as much as possible so we can reduce the number of people who are infected, which will reduce the number of people who get serious illness, which will reduce the number of people who will lose their life. This coronavirus is an equal opportunity virus, no respecter of age, person, zip code, gender. It can infect anyone, and even healthy people. Initial information from other countries did indicate that older individuals were at greater risk for severe illness, but there is data of younger people having severe complications. Overall, we have 422 cases in 22 counties across Illinois. The number of cases is rising exponentially. With increasing laboratory testing in IDPH labs, as well as in the commercial labs and the hospital labs, we did expect to see this rise. As you test more, you will identify more. Because testing is becoming more available, IDPH will be able to prioritize testing for our most vulnerable populations. Testing will be performed for individuals who are part of a cluster of confirmed cases or possible cases among those who work or live in a residential congregate setting, such as the nursing homes. Testing at the IDPH labs will also be prioritized for hospitalized patients with unexplained pneumonia who are from a residential congregate setting serving vulnerable populations. Long-term care facilities such as nursing homes with confirmed cases will increase the monitoring of those individuals and take aggressive infection control measures. However, testing of all individuals is not indicated. We will not recommend tests for every single resident or staff of a long-term care facility. Rather, we will take all the precautions necessary, and as soon as any staff or resident develops symptoms, they will be isolated and treated. If they are showing symptoms, whether they've been tested or not, they will get the same treatment and the same appropriate measures will be taken to care for them. Patients who do not fall into one of these categories for testing can seek care for their healthcare provider, who can then move on forward with the testing at a commercial or a hospital laboratory. We do see spread of this disease across our communities. And these numbers are concerning, but it's not expected. And the more robust information we can gather, that will allow us to better understand and track the size and scope of this outbreak, and then strengthen prevention and response efforts. I want to ask everyone to continue to do their part to help break the cycle of spread. It really will take each of us making our individual sacrifices, our household sacrifices in our community to reduce the spread of the virus and free up our healthcare system for our most vulnerable. Let's all do our part to make sure that lives are saved. And now I'll summarize the comments in Spanish. Hola, me llamo Ngozi Esike y soy la directora del Departamento de Salud Pública aquí en Illinois. Con gran tristeza estamos anunciando que otros 3 residentes de Illinois con la enfermedad COVID-19 han muerto. Estas personas eran residentes del condado de Will, un hombre de 50 años, una mujer del condado de Cook de 80 años y una mujer de 70 años de fuera del estado que estaba en el condado de Sangamon. Sabíamos que iba a ocurrir más muertes. Esta noticia nunca es fácil. Pedimos a todos que por favor se queden en casa cuando sea posible. Queremos reducir la cantidad de personas infectadas. Este virus puede infectar a todos, incluso a personas de buena salud. Como menciona el gobernador, ahora tenemos 422 casos en 22 condados en todo Illinois. El número de casos de COVID-19 está creciendo rápidamente. Con las pruebas en los laboratorios de IDPH y los laboratorios comerciales y hospitales, esperamos ver este aumento en los casos. Debido a que las pruebas están cada vez más disponibles en laboratorios comerciales y hospitalarios, IDPH priorizará las pruebas para nuestras poblaciones más vulnerables. Estamos obligando a hacer pruebas en asilos de ancianos cuando hay 2 o más casos confirmados de enfermedad por coronavirus. Las pruebas en los laboratorios de IDPH también serán priorizadas para pacientes hospitalizados con neumonía. Pacientes que no caen en esas categorías deben buscar atención con su doctor. Ellos determinarán seguir adelante con las pruebas en un laboratorio comercial o hospital. El crecimiento de casos refleja una rápida transmisión de COVID-19 entre las comunidades. Quiero pedirles a todos que hagan su parte y nos ayuden a romper el ciclo de transmisión. Realmente todos tenemos que hacer estos sacrificios para reducir la transmisión de COVID-19 y liberar nuestro sistema médico para atender a los que más lo necesitan. Gracias. Y with that, I will turn it over to Director Basta of the Department of Aging for comments.
Good afternoon. I would first like to take a moment to thank Governor Pritzker and Dr. Ngozi Ezike for everything they are doing to keep our older Illinoisans safe during this evolving situation. I also applaud the idea of the special senior hours at grocery stores, which are meant to provide a safer environment for our older customers. Our older consumers on a fixed income or who have underlying health conditions do not need one more thing to worry about when it's time for them to go to the store to purchase essential supplies. As we know, older adults are among the populations at the highest risk for becoming seriously ill from COVID-19, the coronavirus. Our primary concern, as always, is for the health, safety, and welfare of our older population. And to this end, I would like to reiterate to our older Illinoisans that they are not alone. We all must be proactive here. To that end, we have made tough decisions, like temporarily suspending group services at our adult and daycare senior centers, where older adults regularly congregate for social interaction, but would have put them at higher risk. So we have increased our one-on-one in-home services. Our goal has been to limit the exposure to the virus in older adults, while also increasing the ability to closely monitor their well-being. We have taken guidance from the Illinois Department of Public Health, our sister agency, regarding the screening tool and the process we use, so that both our in-home workers and our older adults that they care for are safe when they do their work. And the agencies in our network, and our entire aging network, are using this screening tool as part of any protocol where face-to-face contact with older adults and more vulnerable adults occurs. The Illinois Department on Aging and our 13 area agencies on aging, along with our 46 care coordination units, are working around the clock to ensure that the services we provide, specifically the in-home services and the home-delivered meals program that our seniors depend on, will not be interrupted during the situation. We have been supplying our area agencies on aging and our CCUs with emergency assistance service grants to assist them with unmet needs. And we are anticipating that the demand, of course, for home-delivered meals will grow exponentially. We have also been working with the State Emergency Operations Center, and we have activated our state's volunteer network to address the needs of our most vulnerable residents, specifically for food and medicine. The voluntary organization in active disasters has a proven track record of rising to the occasion when our nation is in need. Our Illinois team is assembling volunteers and putting in place the proper safeguards to address this ever-evolving situation, and getting our area agencies on aging the boots on the ground that they need to make this happen. So if you are an older family member, if you have a friend, if you're a neighbor, if there is anyone who needs any kind of assistance, please know we are here to help you. Call your local area agency on aging. And so let me tell you how you can do that. You can look up your area agency on aging by going to our website, www.illinois.gov/aging, or by calling our senior helpline, 1-800-252-8966, or sending us an email, aging.ilsenior@illinois.gov. Finally, I would like to encourage healthy adults to find a creative way in the form of non-face-to-face contact, to communicate with our older adults during this time, to monitor their older family members, their friends, their neighbors, who are practicing social distancing. Older adults will experience even more social isolation during this time because they are unable to get out to their normal activities or go to the places they congregate for fellowship. Showing genuine interest in others, sharing positive news, bringing up memories, and through simply doing a phone call can enhance our relationships. And in times like this, it's essential that we support one another and show compassion to those who need it. I like to call it using compassionate common sense. So thank you again to everyone who continues to assist with our mission of aging in place. We are always here to support our older adults today as well as tomorrow. Thank you. And now I'd like to invite Rob Carr up from the Illinois Retail Merchants Association to the podium. Thank you.
Thank you, Director. And on behalf of the industry I represent, I'd like to also extend our condolences to our fellow citizens, to the families of the fellow citizens, both in Illinois and across the nation who we've lost this pandemic to date. Governor, I'd also like to start by thanking you, your senior staff, your entire administration for their cooperation, inclusiveness, and communication throughout the crisis that we faced to date. I've been at this over 25 years, and I've never seen the level of responsiveness and cooperation from top to bottom as everyone has teamed together to try to remove the obstacles that we can help, that are in our way to help make lives better for all of our citizens. We are pleased, the retail industry is pleased to support the governor's call for senior hours. Many of the grocers had already begun to implement, but many, many more have been added. Our list has grown from just over a page to 4 pages and counting just within the last 24 hours. Citizens who wish to check on that list can do so at our website, www.irma.org. It will also be at our social media channels. And grocers and, frankly, other retailers who wish to be added to that list can email us, and we'll be happy to add them as well. And then finally, Governor, I'd also like to thank you for the concerns you're showing for the small employers throughout the state, as well as their employees, who are among the many who are bearing the burdens and the brunt of the necessary decisions that you and others have had to make. And so we appreciate your leadership on this, and we look forward to continuing to help you. And with that, I refer it back to Governor Pritzker.
Thank you. Happy to take any questions. I want to remind you today that we've got reporters that are actually on a teleconference line. They have the ability to ask questions over that teleconference. I'm going to ask my press secretary, Jordan Abadea, to run that process for us, if you would. It's our first time trying this, so bear with us.
So we're going to start with the reporters in the room, and then we'll go to reporters on the line. Tina?
Governor, are there any more nursing home residents affected in today's count of all the residents that you take home living?
I'll turn it over to Dr. Ezike to talk about the nursing home patients or residents, rather.
So yes, we, without getting into specific, details, yes, we have had additional nursing home residents that have been in these counts. And so, again, specific attention has been veered towards them with aggressive monitoring of their situation and intensive measures that we talked about before, the pre-shift assessments for all the staff that come to work every single shift, as well as the visitor restrictions which may remain in place.
There were 42 cases yesterday. Were there any more cases added at that home?
On that home, I don't think there were any individual cases. Thank you.
With the governor's office, please look at your phone right now and hit mute. Thank you.
Any of the fatalities, were they nursing home residents, the new fatalities, or at least two of them?
No, none of these fatalities were associated with the nursing home. Thank you.
And Governor, are you looking at any kind of shelter in place, wider shelter in place for the state? And also, if Indiana has extended school closures to May 1st, are you considering something that here, what should parents be thinking about in terms of April?
As I've said at most of our press conferences, I'm looking at all of these things literally every day. We're contemplating what are the moves that we need to take based upon the guidance that we're given. I know that there are discussions at the federal level and, frankly, among the advisors that I have, who are some of the experts in the world that are here in Illinois, that would guide to this is going to take longer than people have expected. And so we're listening to that guidance and operating based upon that, every day.
Any school closures that
I think that obviously we've set a deadline, a date by which we think that students would go back. But, I also think that parents should be contemplating the possibility that that might be extended.
Number of cases total is 422. Is that correct?
422.
422 cases.
Press release says there are additional 136 cases. 136 plus 288 is 422.
We will clarify the numbers for you.
We'll make sure we get it right for you.
Governor, in terms of the small business loans, can they start applying right away? What needs to be shown in terms of losses and an anticipated turnaround time for actually getting money into people's pockets?
At the website that I talked about a little earlier, that's where people will have the ability to apply. And I don't want to go through the details of what they're requiring at the SBA for those disaster loans, but I would point out to you that, as you can imagine, the restaurants and bar owners, are suffering. We're only, 3 days into the closure of the restaurants and bars, and those folks are, every day that's gone by, they've suffered losses. And as you know, that closure is extended all the way to March 30. So people are going to have some significant losses. There are many restaurants that have, under $750,000 of total revenue during the course of a year, and profitability at restaurants varies, but it can be relatively low percentage profitability, and so people are truly suffering. So these SBA loans will be an enormous help to them, and I'm grateful to our federal partners, especially our federal representatives, for getting this done.
Craig, you're going to have the last question.
Craig.
Governor, what is the threshold, or what would officials need to see for you to actually make a judgment that a shelter-in-place order were necessary?
Well, what's interesting, Craig, I'm glad you asked the question of what are the triggers for us making decisions. Honestly, look, my expertise is not as a scientist or as a doctor. And so epidemiologists, as well as those who are experts in public health, are those who I rely upon, both here in Illinois, and we have some of the best in the world here in Illinois, and I've also called others around the nation so that I can better understand what are the things that they're looking at. Many of the people in this field are very, very concerned that the United States is not doing enough. I think you've heard that on television, and when we talk about bending the curve, we say it like everybody understands, but what we're talking about is making sure that we don't end up in the situation that Italy is in. So when I make decisions about this, this is about how do we operate faster and better than Italy and than other countries that have seen this, grow exponentially for a very long period of time. And so we're trying to stay ahead, be ahead. Illinois has been one of the first states to move on these things. Many other states have really followed by days after us. And I'm going to continue to listen to the experts to do the right thing. The triggers are really in what the experts are seeing. And remember, there's another part of this. Because there's so few tests that have been done, even across the United States, we're really relying upon not only the tests that come in, but also the statisticians and mathematicians who are taking the test data and extrapolating from that what probably will happen based upon what's happened in so many other countries, even ones with very, advanced medical infrastructure, and so that are very much like the United States.
Jerry, you're going to be the first person on the phone to ask your question.
We're not hearing a question from Jerry.
Okay, we'll do Dan with the Tribune.
Got it, thanks.
Is that Dan?
Dan Petrella, you can ask your question.
What, we can't really hear what's going on here. Has somebody already asked about shelter in place?
Yes, they have asked about shelter in place, so I won't repeat the answer. But suffice to say, we're evaluating every day.
Question for you then. Let me know when you're ready for it.
I'm ready. Thank you.
Okay. Can you talk any more about the National Guard testing sites, where those will be and how that will be conducted?
National Guard testing sites is the question for those in our audience online. We are working with the federal government. The federal government is standing up, by the way, drive-through testing. We haven't seen that yet in Illinois, but we have drive-through testing, but it's not the federal government's version of that. And so we hope to see that sometime soon. Instead, we're having our National Guard be part of efforts to help hospitals and other healthcare centers stand up those drive-through capabilities. So we'll be using National Guard to assist other healthcare workers in that endeavor.
Okay, Dave Dahl, you're up next.
Dave Dahl.
Okay, Tony Arnold, how about you?
Yeah, Governor, I'm wondering about what guidance you can give to schools or parents for that matter about when they could expect students back in school.
Well, the guidance that we've given is that school would resume March 31st. There had been a question in the room for those who didn't hear on the telephone about whether that might be extended, and the basic answer is that we're obviously evaluating that every day. I would say to parents that they should obviously be planning for the possibility that there would be an extension of that date, but right now we're sticking with the March 31st date.
Dana with CBS, you're up.
Dana?
Okay, thank you. I have a question about the cases and the rise in cases, actually from someone on Twitter. Are the cases rising because and being diagnosed because there's more testing, or is it because it is spreading more quickly, or both?
Right now, the case numbers are appearing to rise so rapidly because we're testing more. We have increased testing substantially. When we were beginning testing, we were at about 200. We were at about 200 tests per day at the very beginning. We're now over 1,000 per day, and we'll be increasing that to 2,000+ in the next few days. And then I believe we'll get to a number that's much higher than that in the days after that. So that's why we're starting to see an increase in the number of positives. But no one should mistake that fact for the idea that we're not seeing a significant increase in the number of people who are contracting coronavirus COVID-19, because that also is happening. And we know that in part because the work that the mathematicians, the statisticians are doing looks at where the cases are, how the cases are being contracted by others, and it's frankly 4 out of 5 new cases that get reported nationally, this is, 4 out of 5 of these cases are people who contracted it from someone who had it but didn't know they had it and exposed other people to it. So if you didn't know you had it, well, there are lots of people who've never been tested who have it and aren't showing symptoms, who are carrying it around and giving it to other people. So we know this is growing substantially, and until there are more and more tests, we will be, in this situation of just seeing the numbers rise because the testing is rising. We hope that there will be a cresting that you have seen, frankly, in Asia now. In some countries in Asia, there's been a cresting because they've implemented some of the measures that we have implemented here. We've done it earlier here, but that doesn't mean that we're not going to see a lot of cases of COVID-19 and, frankly, more deaths.
Brian Mackey with NPR.
Brian?
I'm here. Hi there. Thank you. I wanted to ask, I heard you mention the National Guard potentially retrofitting and reopening some previously closed hospitals. Is that work underway? And in a more general way, what is Illinois doing on its own, given what the federal government is not doing, and make sure it has enough hospital bed capacity and ventilators?
Thank you for asking. The question was about what we're doing to stand up more hospital beds and more capability to serve patients across the state. So first of all, we had to inventory what beds were available, what hospital rooms are available across the state, and what the expectation is about just the other cases. Remember, there are people who have heart attacks and have other injuries that they need to be treated for who are in the hospital, and there will continue to be some of those too. So we're trying to project, we're looking at what's available now, and then we're looking at all of the available other opportunities for us to increase hospital beds. There are 2 types of hospital beds that we're looking for. One is and I say beds, I mean rooms. And the ability to serve the people that are in those rooms. So 2 types. One is those who are COVID-19 positive, who need to be treated for COVID-19. And then there are those who have some other illness that they're in the hospital for, and they will need a bed. And we're trying hard to stand up more of both of those types of beds. The more that we can alleviate the existing infrastructure of non-COVID-19, the more likely we are to be able to serve the vastly increasing population of those who are tested positive for COVID-19. So we are, as I say, we're reopening hospitals. We're looking at all the hospitals right now, inventorying how to reopen them. So we've got people on site in many cases, looking at, remember there's plant and equipment that you have to turn on. It isn't just as easy as turning the lights on. And then we've also got to have the healthcare personnel to move into those hospitals to make sure that we're serving people properly. And then there are existing Surgery centers and other places that have the potential to provide beds for people that aren't normally places that would just accept a COVID-19 or other kind of a patient. So we're, again, outfitting those folks, but they also have nurses and doctors that are on staff, and so they have a little more capability to begin with altogether. So we're working hard with all the hospitals too, and that we no longer have elective surgeries going into our hospitals, so that alleviates many of the beds. It also, frankly, puts a financial burden on the hospitals themselves, who, subsidize other care by doing elective surgeries often. So anyway, that's a lot of what we're looking at, and we're going to continue to look at even more expansion that may include things like literally building a field hospital in Illinois and in various places. We're also looking at how do you alleviate some of the intake that goes on at a hospital for people who really don't need a bed. Sometimes they are put in a bed anyway or were a month ago or 2 months ago. How do we alleviate some of that? Who could really convalesce, for example, at home and not be in the hospital? And just evaluating, what does that look like? How do we encourage that? Shia?
Hi, Governor. Thanks for taking my call. So we keep hearing that Governor Cuomo seems to talk to President Trump every day. I'm wondering, have you talked to the president one-on-one? And if not, why? And if yes, what have you talked about?
Well, the federal government, the question was, do I talk to the president as frequently as Andrew Cuomo, the governor of New York? The reason that the president talks to certain state governors more than others is because that's where the bulk of the cases are, right? In New York and Washington, for example, as a percentage of their population, they are seeing a lot of cases and frankly, a lot of deaths. And so I believe that that's, how the president may have prioritized his time. I have the ability at any time to reach out to the president. He has offered that to me directly. I have talked more often with the vice president. This is now, I don't know the number of times now, but several times directly. But I also want to point out to you that many of the people who work under them and really in the agencies, I'm talking about the Assistant Secretary of Health and Human Services, the Secretary of Homeland Security, those are people that I talk to more regularly anyway, because they're on the ground, at least closer to being on the ground and delivering what we need. Because this is it's sometimes an order or somebody at the top says something. I'm talking about the president or the vice president, and then it goes through a bureaucracy and takes too long. Sometimes that happens, and so I, in many cases, have just called directly to the person who's in charge of the thing that we need in order to get it. So I've been willing. I don't need to wait to talk to the president. I'd rather just go get the job done.
Thank you. Governor Pritzker, along with the human tragedies that you've noted, what are your expectations for the longer-term economic costs for Illinois and the fiscal costs for the state due to COVID-19?
Well, there is no doubt there is an enormous cost that everybody in Illinois is bearing for, the economic damage that is coming from COVID-19. This is not just the sickness, the cost of health care, it's also the cost of jobs. We've seen many, many layoffs, many people who have joined the rolls of unemployment and Medicaid. And so, the cost is enormous, and that's why every day I have been in touch with not just our elected federal representatives from Illinois, but many of the other leaders in Washington. Yesterday, I spoke for about 10 or 15 minutes with the Speaker of the House, Nancy Pelosi, and expressed what we need here in Illinois from them, what kind of legislation we would hope and expect that they would get passed for us, and how we would want it crafted so that it benefits Illinois. So there's no doubt about it. This is going to have a significant economic effect on Illinois, and we are trying to mitigate that damage just like we are trying to mitigate the virus itself. Marianne?
All right, we'll do Dave Dahl, you're back on the line.
Dave Dahl?
I'm here. How do you read me?
We can hear you. Thank you.
Thanks. Okay, and thanks for making this available. Speaking of business and the economy, there's a group called Illinois Business Alliance, which came out today with a news release saying with the economy, the way it already is going down in Illinois, this is the worst time for the graduated income tax, and you ought to pull it off the ballot. What do you think of that?
I would just say this is not a time for politics. We have too much to do to save people's lives. We're not focusing on, legislative initiatives other than focus right now on what it will take to provide the health care and the unemployment and the services that people will need in what is going to be an increasingly difficult moment for everybody.
All right, Marianne, are you there?
Hello?
Marianne?
All right, thank you everyone on the phone. I think we got through most everyone.
Thank you, everybody.
Jordan,